One of the things people talk a lot about is the anti-inflammatory effects of cannabis and of CBD. Studies do demonstrate that there are anti-inflammatory effects. And as many of you know, inflammation is a prime driver in pain in a lot of our pathologies. Frankly, inflammation is a prime driver in a lot of our pathologies, period, whether it's heart disease or arthritis, but I digress. The pain of inflammation associated with arthritis can be benefited typically by drugs we call NSAIDs, NSAIDs, non-steroidal anti-inflammatory drugs. We call them NSAIDs. These are things you recognize like ibuprofen, Aleve, drugs of that sort. And although very good drugs, they have their own set of side effects, which we've become much more aware of in late years. So we really like to try to limit the amount of NSAIDs we use in people. Okay, one of the techniques I use is to use CBD to help as an NSAID sparing adjunct. So what is an adjunct? An adjunctive medication is when you use a medication in a lower dose with your main medication to increase the benefit of the patient without just increasing the dose of your main medication. Because typically when you increase the dose of your main medication, you also increase the side effect profile. So we as physicians, especially pain medicine physicians, try to use adjunctive medications with our treatments to achieve the pain relief we need in patients. So for me, with NSAIDs and the risks now to the heart, to the kidneys, to the liver, we now use CBD as an adjunctive medication to help attenuate some of the inflammatory pain. Another way I use it as an adjunct is with narcotics. We all know we have a narcotic problem in America. Narcotics have their place in medicine. We need to be frank about this. But they're also deadly. They've been abused in the wrong settings. They can be deleterious to patients. That said, when you break your leg and you're given a narcotic for a broken femur, it works. And it is a good choice for somebody who just fractured their leg an hour ago. A year later, when somebody's still using this for chronic pain, one of the insidious things people don't realize is narcotics stop working. At that point, a year later, they think, well, I'm taking my pain meds for my pain. Well, how do you hurt? Well, my pain's 8 out of 7. Of course it is, because the pain meds are no longer working. What they're basically doing is preventing you from going into withdrawal. Okay? And it's a very difficult thing with pains. And this is why, to be quite honest, we're starting to realize in medicine that narcotics are not a good option for chronic pain management. This is where CBD can be a nice adjunctive. Is it a be-all, end-all? Is it going to treat all their pain and severe pain? No, absolutely not. But we don't have anything that will. An adjunct is a nice way to potentially start to taper back some of their narcotic medications. Now here's an aside, is that one of the things that happens when you come off of opiates and you bring down narcotics is you get withdrawal effects. You get sweats, you hyperventilate, your bowels get loose. These are adrenergic, noradrenergic effects, which these are the same molecules, which stick with me here. Adrenaline is what gives you anxiety, is what gives you that anxiousness, noradrenaline. These are anxiety type effects, and as we've already learned, CBD can be used for anxiety. So one of the nice things when CBD is used as an adjunct for pain control with narcotic management, that when they start to get some relief, because their narcotics aren't working anyway, you can start to titrate down their narcotics, and when they start to present with adrenergic, noradrenergic effects from withdrawal, the CBD can help ameliorate that, because as we already know, CBD can help with anxiety type presentations. So once again, we need to be realistic about this. This is not a be-all, end-all to replace narcotics, but in a very difficult setting with patients, CBD can be a very powerful tool to help bring down our narcotic levels and help the patient have some faith and some confidence and some pain relief as we're trying to get them back to a healthier state.